Good evening, everyone, or early evening. I'm Mayor Emma Mulvaney-Stanek. Welcome to, I believe this is our 5th Community Safety Forum. We've held these for about a year or so on a different combination of topics each time, with a real effort to share what's happening here on behalf of the city government and our partners in the community here in Burlington on the very nuanced and multifaceted aspects of community safety here in the city. Our format is pretty much the same as we've done in the last few rounds of these safety forums, which is I'll offer some welcoming opening remarks on just overall some updates on community safety that have been underway since our last forum. And then we'll do the first panel tonight. We have 2 panels for you tonight. We'll be focused on the issues of homelessness and mental health and the city and larger regions' response to those issues. The folks up here I'll introduce in a moment when we get to the panel, but they're a combination of community partners and city staff who've been working hard on this issue for many years. And then we'll take a minute to reset the table and have another series of panelists join us because we felt it was really important, especially of late, to add a second item tonight on the issues facing our downtown, our center core of the city. And we want to make sure there's updates also from our Burlington Police Department because there's been a lot going on, especially in the last couple of months. So we'll have a different set of panelists, all from the city, up here to talk about those issues. At the end, when we have about 30 minutes, and if you've been with a meeting that I at least am in charge of, I run a pretty tight ship with keeping us on time. I think the sun is actually kind of out, and I just want to honor people's time both on panel and in the room. But we'll make sure we have about 30 full minutes for Q&A. We have a design here over the last few forums where we have developed a hybrid approach. Not everyone is comfortable speaking in front of a large group. Many people have similar questions, so we'll hand out cards for you to write questions throughout these first 2 panels. That way you can write multiple questions if you wish, and then I'll do a hybrid, meaning I will have my team assess what questions are sort of similar, and they'll ask a unified question on a theme, and then I'll go to someone live in the audience, and we'll go back and forth, and we'll see how that works. I will remind us when we get to that point a little bit about how we build community and hold civility when we have very passionate folks in this community and really hard topics to talk about. I'll just remind us of how we're going to engage in that Q&A so we can share the space and keep it productive. But that's the game plan. Sound good? All right, well, again, welcome. And I wanted to also start with just opening reflections about how much has really heated up in the last few days, especially here in Burlington, and wanted to make sure that folks know that part of what I see my job as mayor is to really find ways to bring us together across partisanship, bring us together again across polarization. Things that have just been very difficult and bubbling and building for a while have made things harder and can make things much harder than they need to be. I know that we all care deeply about our local businesses and the health and well-being of our downtown. I also know that people in Burlington live here because of the values we all share around human dignity, around the needs for people to meet their basic needs, around the value of mutual aid, especially coming out of the pandemic, and that we have so much of that in common, and we hold that even when we are in disagreement. And so we're in a moment of some disagreement and some heated energies in the city. And again, I hope that in the course of the next couple of days, we will continue to find a path towards better understanding, compromise, solutions that really bring people together. And again, my job as mayor is to really help try to facilitate to the best of my ability. And so I offer that all to you. So tonight, in terms of community safety updates from various parts of city government, I wanted to announce for folks who are not familiar with this particular tool, but we're starting a new pilot called the Situation Table. This is a high case intensive management system that has been developed in many parts around Canada and now been used in dozens of cities across the United States and in 4 other towns in Vermont that allows communities to bring critical partners to the table, including municipal staff, to really address folks who are causing harm or are like high needs, high risk in our community, and using our community safety response system a lot. So when you look at incidents count reports, for example, with the BPD, a large number of those numbers that count are a small number of people. So this is a real strategy. I'm actually excited to bring online. Ingrid Jonas, my senior advisor on community safety, has done a lot of research into this and advocated with the state of Vermont to get the 5th and final spot in this grant-funded program, so it's free to the city, but it also allows us to plug in to the learnings and the data collection from Bennington, Springfield. I will not remember the other 2 communities, but it's a really good and important piece. And we're launching on Monday our orientation for the city and community partners. 50+ entities have been invited to engage. And then we'll launch that. We'll do a training later in the month of June and launch in July. I'm really hopeful that this will start to create some new ways of accountability, but intensive and relentless support and intervention when necessary for folks who really need that level that we've not been able to do before. Also in July, we'll be relaunching CompStat, which is a longstanding convening of different partners who've often looked at and focused on substance use and what the data is telling us and the trends telling us in our community. When I came in as mayor a year ago, we had really been hyper-focused on the data and stepped a little bit away from as strong levels of policy coordination and coordination with also case management. So we're seeing Situation Table and a relaunch of CompStat in July as a dual strategy, one for which we're tracking as we need to, the data and what the data tells us, but also wrapping around with what this case management team and entity can do, and then of course policy changes that really should inform on the city, regional, and state level. I also want to let folks know that in the category of accountability, our city attorney team and many entities of city government and our local partners and also Community Justice Center and our partners at the state's attorney's office have been trying to figure out how do we make the accountability system work better and innovate in that regard. And so 2 things we will be talking more about, again, more in June, is the launch of a city circle design. It's considered kind of like a mini court system where we're working with both our CJC restorative practices system for folks who cause harm, having an option to do a restorative practice. Don't look at me, Rachel, I'm going to butcher this now. Our director of CJC, just look elsewhere, it's fine. Oh, and then if that's not the option, and when someone causes harm, again, a municipal ordinance violation, for example, they can take a path instead in our court system. Things have been getting caught up in a court backlog. Folks have heard me talk about that's been a backlog since COVID, and we're trying to bring something that's a little more in our power as a city to help facilitate more real-time engagement with people and real-time accountability. Hopefully, of course, people choosing the CJC path, but making sure we have some more, I shouldn't say instant, but more immediate response rather than waiting weeks and months sometimes for the court system to catch up with the actual incident with the day in court. Also want to mention that maybe even right now, our new chief of police, our interim chief of police, Sean Burke, is presenting to the Public Safety City Council Committee a new strategy on how to recruit police officers to the city of Burlington. There's a 3-page plan. You can see it on Civic Clerk for the Public Safety City Council meeting. It's again happening right now, unfortunately, at the same time. But it is a new approach. There's some new ideas. There's some low-cost ideas. There's some relational ideas in that list of how to bring more officers to Burlington and to do that in a strategic way that actually gets us folks in the door and starts to leverage those who work for the police department now in smart ways to tell stories, to attract people, to use, again, those relationships to bring people in the door, but much more. So please take a look there. We'll probably bring him to a city council meeting soon for a work session on that as well. I also want to note, speaking of police, we of course have Lieutenant Henry, who will be here later. He said he's going to go read a book for the first part of this. I'm just joking. He's here somewhere. But he's a lieutenant assigned to the downtown center city. But just speaking on police, I hope you've seen, because I certainly hear this pretty much every day, more officers out of vehicles and more visible in all parts of our community, largely in the downtown. That is not by mistake. That is by design and leadership of interim chief Sean Burke. And it makes a difference. And it makes a difference because it starts to bring back the direct contact and relational work that community-based policing is all about. It also allows folks to just be able to engage with that piece of our community safety system in more direct and meaningful ways. And it also just helps the other aspects of our system work more in hand in hand. So our street outreach team is a partnership we have with the Howard Center, which we'll hear tonight at this panel. But it's something I have seen progress from, and I hope you do as well. And I look forward to hearing your feedback if you've been noticing that as well. Speaking of the Howard Center, I have only a couple more updates. I am proud to announce, as part of my recommended budget for fiscal year 26, a significant increase in our investment into the street outreach team that, again, is run by the Howard Center. This is a program that is run for 15, 20 years or so. It's expanded from literally one person doing this on the street intervention and relational work with folks largely who are struggling with mental health, but Tammy's here to say a lot more on that. But it obviously, the needs and the number of people who are suffering from mental health issues in our city has grown significantly in 15, 20 years. However, the city's contribution to that program has been static. So we are increasing it significantly to $250. It's $249,000 for the upcoming year, because that is such a critical piece to make sure is stabilized and supported and invested by the city. And then the last thing I'll say tonight, we also have Teresa Vizina, who is our specialist on the Overdose Prevention Center implementation work we need to do. And she's developed a handout. We have a lot of handouts for folks to take if you're interested on what comes next in the siting of an Overdose Prevention Center. Where are we within the process of bringing on that piece of our system? What's the timeline? What's happening with the state of Vermont and the partner for which we selected, who would be the service provider for that center. So she's here, and you can certainly say hello and introduce yourself, and we'll be doing a lot more public education on that as the grant starts to be released from the state of Vermont in the coming months. And then finally, if you want to hear a lot more in detail about any of this, we hold monthly press conferences on community safety now, and it's something you can stream on Town Meeting TV. I always give a little commercial shout out because they come to literally everything. It's like, I see you more than my family sometimes, but I really appreciate it because it's a way for the public to see what we usually say to the press in full, unedited, and it's a good way to get a full update on the situation table we'll talk about in June, the city circle I mentioned, police recruitment, those types of topics we'll go much more in depth on. That is June 18th. All right. I think that's everything you need to hear from me. So to kick off our panel, our first panel again is going to be focused on homelessness and mental health. And by the way, if you have questions on anything I rattled off rather quickly, feel free to again use Q&A for that. That's not off limits to ask questions about. Feel free to capture a question or two on those several items I mentioned. Our first panel tonight will be focused on homelessness and mental health here in the city of Burlington. And I have several outstanding community partners really at the table with me here tonight, both within the city and elsewhere. I'll briefly introduce each one of them and then tell you a little bit about the questions they'll be each speaking to when I give them each about 5 minutes to speak about their work. So this actually, but we're going to pop around a little bit. So Sarah Russell to my right will begin, and she is our special assistant to end homelessness, working out of the city of Burlington for the last handful of years. Sarah will speak about the city's side of the response. Then we have Anna Wagling. Oh my gosh, excellent, okay. Who works as our community support supervisor within the Burlington Police Department. And this is an umbrella of lots of different response pieces of our non-sworn officer staff within the BPD. And she'll explain a little bit, first of all, what that is, because I think the city residents often still need to know what those different roles do. But then we'll speak to a little bit from their perspective. And then one of our strong community partners, Tammy Buddha, who is the team lead for the Howard Street Outreach team I mentioned just earlier there. Tammy's been a longtime partner and leads this team of multiple folks in the downtown every day. The last two we are joined with are Michael Monty, who is the CEO of Champlain Housing Trust, who are our partners over at the Elmwood Shelter, is one property, but they're a partner in so many other ways around emergency housing. And then finally, Paul Dragon on the other end here, who is the Executive Director of CVOEO, Champlain Valley Economic Opportunity Office. Yes? That works. All right, okay, close enough. It's our CAP agency, another critical partner who does a number of things for folks in the region, but specifically has been a big partner on our extreme cold weather sheltering, as well as our community resource center that supports a lot of our unhoused folks in the community, and much more. So to begin, we've asked our team on the panel to describe a little bit about what they do and their organization and how it addresses homelessness and or mental health. And then how the work has shifted based on how the needs in our community have shifted in recent years, to give you a sense of innovation, adaptation, those kinds of things. and then to see where there are opportunities for positive movement towards more long-term solutions. We are often at the dealing with the symptom stage of things, but where are the opportunities for more long-term sustained solutions in this work? And then if they have time in their 5 minutes, they each have a third question around tangible actions that all of you as community members can do to support their work. So that's kind of the arc that they'll take us on in each of their 5 minutes or so. I will keep us on time and give you a polite tap when we get to about 1 minute when you each have that time. Okay, so first up we have Sarah Russell, who again is the city's specialist, a special assistant to end homelessness.
Thank you. Can everybody hear? Is this on? Okay. Oh, I have a lot of water in front of me in case I get thirsty tonight. Thanks, Mayor. It's really nice to be here to talk to all of you tonight. As the Mayor mentioned, I am the Special Assistant to End Homelessness for the city. I have been in this role for about 3 years. Prior to that, I have held various direct service and leadership roles within our social service sector here in Burlington for almost 25 years now. So I've been working here with folks for a long time, almost half my life. My role it tends to evolve and flex based on the needs that we're experiencing in the city, the season, and the specific things that are right in front of us. So high level, I oversee and implement and in an ongoing way evaluate the city's policies related to homelessness. I also oversee our response to unsheltered homelessness, which includes, when we say unsheltered homelessness, we're referring to people who are sleeping outside, what we would say not in a place that's meant for human habitation. So that would include, thanks Michael. That would include sleeping in cars, sleeping in tents, in our transit centers, our parking garages, or sleeping rough, which I'm sure you're all pretty familiar with witnessing across the city right now. In addition, we provide some very strategic leadership to the Chittenden County Homeless Alliance, which is a regional decision-making body to apply for and distribute funding directly from the federal government in our response to homelessness. We also work really hard on expanding shelter capacity, which is desperately needed. The way that we understand the kinds of housing and type of shelter and number of shelter beds that we need in the city is by looking at our data. So a lot of my work focuses on making sure that we have proper systems in place, consistent and quality data. That data drives, like I said, the kind of housing we need and the number of shelter beds that we need. Here in the city, we are severely lacking, actually statewide, we're severely lacking shelter capacity. So we play a convening role with our shelter and service providers across the Chittenden County, not just in Burlington, across Chittenden County to talk about how we can support our nonprofit providers with expanding shelter capacity. We also talk a lot about supportive housing, and of course that needs to be affordable. We rely deeply on the federal government and HUD for rental assistance. We see those programs cut back, or being diminished right now, which is really hindering will really hinder our ability to exit folks from homelessness into permanent housing. We also want to make sure that there's the affordability piece, that we have the unit, and then we have the services to help people to prevent homelessness, which is something that we don't talk a lot about. We also do a lot of work to prevent homelessness. I'd love to hear more from Michael at CHT. They have an amazing housing retention and resident services program and are doing some really innovative things around preventing homelessness, which is just as important to keep an eye on that inflow as it is to make sure that we are experiencing that outflow into permanent housing. Let's see. So 1 minute. 1 minute, okay. Where do I see the possibility of the opportunities? There are lots of opportunities with shelter capacity. I think the thing that we would rely on the public to do and to get involved is to educate around some of the reasons why folks are being homeless. There's always opportunities to attend the Chittenden County Homeless Alliance. Those are public meetings open to the community. In addition, there is a great deal of advocacy that you all can engage in with your legislators and with the governor around ensuring that our homeless response system is adequately functioning and funded to be able to do this work. So I guess I'll wrap up there. Thanks.
All right, overachiever already with 15 seconds still on the clock. And part of what I just want to emphasize, the legislature is ending probably as we speak right now, and so Sarah's been really instrumental in helping us with our legislative strategy and trying to really make sure state-level solutions are brought online. So if you have questions about that, I encourage you to ask, but we also may not know where literally the dust is settling, so we don't even perhaps know the final version of a very important bill, for example, H91, which will change how the state does in about a year's time, the homelessness response, what we call the motel program in particular, how that gets run and administered. So thank you, Sarah. Okay, let's move on. So to Anna, again, who's our community support supervisor within the Burlington Police Department.
Hello, everyone. It's not on. Doesn't sound like it's on. Great. We're gonna move over to this one. All right. Hello, everyone. I am going to try my hardest to stay within 5 minutes. I don't have a choice, though. So my name is Anna Wagling. I am the community support supervisor at the Burlington Police Department. I started originally as a community support liaison, the first hired at the police department when the program was rolled out in the fall of 2021. So we're coming up on 4 years of this program existing the way that it does. My background is in refugee resettlement, so my background is working with people from all walks of culture, and when the program started at the police department, I was asked by Lacey Smith, who is the assistant director, to step into this role with the background that I carry. So I am a supervisor within CAPE, which is Crisis Advocacy Intervention Program. So that division within the police department encompasses currently 5 CSLs, so we're hiring if anyone is interested in an evening position. So we have 5 CSLs, community support liaisons, who are general social workers. We respond to calls when it's deemed that an officer is not necessary, so law enforcement is not necessary to go out to that call. We connect to people after police contact has been made. So that might mean that we go out on scene, or an officer will come over to our part of the department and ask for us to follow up with either a victim, a witness, a perpetrator of a crime, someone who's been accused or arrested. So it doesn't matter who they are. If they've had contact with the police department, we can work with them. And usually our first question is, how can we help? What do you need? And we start there, and then it could be really anything. It could be, I need help getting connected to the Chittenden Clinic. It could be, I need help with filling out housing applications. It could be like, I really need to go to the hospital. Anything. Or I just need to talk to someone. I need someone to listen to what's been going on for me, and that's how we can be supportive. We also have a clinician with CARES, which is a new program. That is a mental health clinician, and their goal is to be a bridge for mental health services. So they work very closely with Tammy's team, Howard Center Street Outreach, and they work on, again, that bridge, that mental health bridge, to get someone connected to longer-term mental health supports. There's also a clinical supervisor, and she is involved in drug court and the reentry program on the federal side. So she's everywhere all of the time. We have, and then lastly, we have we have a domestic violence victim advocate, Mary McAllister, who's been with the department for 25 plus years. She knows everything about the court system and supporting survivors, and she is, I believe, the only DV advocate embedded in a police department in the state of Vermont. And then lastly, we have our victim services specialist. That person is embedded at the Burlington Police Department, and they are a CJC employee. And so anytime there's a victim of a crime or someone who has been harmed by crime or in any capacity, we connect Hannah to those people. And we all work in a very small space within the police department, so there's a lot of collaboration and coordination with the street outreach team as well. We work many hours of every day, so everyone works 4 10-hour shifts. So we start at 8 a.m. and the last person clocks out at 9:30 p.m. and that is 7 days a week. So if you ever need a social worker, we're your people. And if something happens in the middle of the night and someone really needs a social worker, then they will call me. So we're available. The types of calls that we go to welfare checks. We can take threats and harassments calls. We respond after domestic disturbances alongside our DV advocate. Public assist calls. We help with restraining order applications, no stalking applications. Again, we collaborate closely with the CJC on providing those services. Oh my God, really? Good Lord. Okay. I'm going to go to the questions. So we do a lot of outreach to encampments. We work really closely with the park rangers, our urban park rangers. So we are always, if you see a tent, we know about it and we've made a connection to that person, or we're trying really hard to connect to that person. And we always ask them about getting connected. Like, again, how can we help you get connected? Do you want to get connected? Let's see, opportunities for positive movement. The situation table, as the mayor mentioned, is really important. We need to break down the silos of communication. Oh my gosh, that was crazy. Okay, thank you. Silos of communication. So that's our main goal, and that's why we're really excited about the situation table, is that we can come together and truly take a holistic and proactive approach or reactive approach to supporting people, because it's really hard to communicate with how things are set up now. Thank you. Oh, gosh.
Don't worry, I'm sure there'll be questions. Don't worry. Thank you very much, Anna. Okay, we're going to move now on to Tammy Buddha. And does that mic work? I just want to make sure before we
test.
Excellent.
Yes.
All right. So Tammy Buddha, again, is from the Howard Center, and she leads the street outreach team.
Hi. So I've been with the street outreach team since 2003, working with Matt Young, for those of you who might remember him. I became the leader of the team when he passed in 2017, so I've been in the role as a leader for almost 8 years. In the role for 22 years. It's a long time. I actually have been working with Sarah. Yeah. I'm working with Sarah so long, I've forgotten her name. But yeah, when she first started working at COTS, we were new people together. So what does street outreach do? We started off in response to kind of a lot of what's going on now, people being displaced, struggling, in need of services in the greater downtown area. This was back in 1999. I think cell phones had just been invented or were being actually used. So police were getting a lot of calls because people were being trained to call 911. Police would show up. They would be like, I don't know what to do with, this isn't a crime. This is somebody who's mentally ill. I can't do anything about this, and I feel bad as a human being just leaving them here. So the merchants and community members got together, and that response ended up being Matt, in the form of one person, as somebody who would be present on the marketplace to get to know people, to find out what their needs are, to build rapport. A lot of people were having a lot of very acute needs, sometimes violent, sometimes dangerous, sometimes just scary. And part of Matt's charge was to try to get to know people, to diffuse situations before they happened, but also to try to coordinate the appropriate response if something did happen. So that we grew in that over time. In 2007, then Chief Mike Sherling said, you know, we've been working together unofficially for a really long time, because Matt and I would be standing on the stanchions by the old bus stop on the corner of Church and Cherry, and the police would see us having someone come in and check in with us, maybe processing something that happened about the night before, or wanting to get in touch with their case manager, asking about how to get services, and the officer had just worked with that person, had just been called to that person the night before. So the officer would come over and say, hey, you know, I know you guys are bound by privacy laws, you can't tell me anything, but let me tell you what I'm seeing with Joe, because Joe really seems to be struggling, and I need somebody to know about that. I need you guys to know about that. So in 2007, we sort of more formalized that relationship and became embedded in the police department, which some of you may remember Justin Verrett. He was quite a character, and he was our first embedded street outreach worker. So what that meant was that in addition to being part of the designated agency where we have access to protected health information and people's history, through that means it meant that we were also able to have an idea of more of an idea of what's going on in the city, what's playing on at night with the officers, because oftentimes when somebody's having a mental health or a substance use crisis, or really kind of any kind of crisis, because we have been trained to call 911, the police will be the ones to show up. So that kind of gave us sort of a larger lens so that we could have a more informed and more in-depth response to people's needs. So what we do every day, now that there's a team of six of us, but functionally 5 because Dave is embedded at the library here, we go out into the community, as we always have, to check in with people, to see who's new, to see how people are doing, to try to anticipate if there's going to be any interpersonal conflict later on in the day, if somebody's going to be struggling, if somebody's going to be in need of some sort of an acute intervention, be it through first call, or maybe we'll have to call an ambulance, or maybe, you know, it looks like there might be some violent criminal activity that the police might ending up getting involved in, kind of trying to get a handle on that and create a response.
About a minute left.
A minute left, okay. And then once that happened, or once we've done that, then calls come in and we respond to emergency responses. So that's when we go out with first call, the police, and respond in the moment. So similar to what the CSLs and CARES do, but more in terms of like we support people saying, what do you need? But it's a more targeted kind of acute response that we're able to give a lot of the times, in addition to the day-to-day needs. Opportunities to move forward, I too think that bringing back the ComStat and the situation table, which I think is going to be a more refined version of a lot of the things that we've been doing. I mean, it's actually not new to us, that concept, but it's a much more streamlined product. And I think that's going to help us, because there's a lot of us out there, and I think we do spin our wheels sometimes, and I think this will be able to help us be more intentional and focused and serve the people that we're trying to help much more efficiently and effectively.
Thank you, Tammy. And this is probably a good commercial moment to share what our community, this is our safety and security guide. We've done various iterations over this first year of this document, and we have handouts here. A lot of people take a picture of this and have it on their phones. And what you can't probably see here, but each of these boxes has a different part of our safety response system with a phone number. And it's not 911. It's specifically the direct line to these particular entities, with a little bit of a synopsis on like what it is and when, in what scenario might you want to call street outreach, for example, who's on here. And they're the dark green box on here. We keep adding to it based on feedback, so we have additional, and these are little QR codes, which is essentially you hold up your phone to take a photo and it brings you to a website. But we have additional things we've added on here over this first year, including how do you use a drug tip line. People do listen to and respond to that at the BPD. How tips on talking to the BPD or a CSO so that you get the right information across so they can be more responsive. It's like a two-way street in terms of getting the kind kind of response and the kind of information that everybody needs to get you the right kind of help. So I encourage people, if you haven't seen this version with this number of boxes on it, this is the updated version. It's also up on the city website, and I think on the police department website, or it's about to be finally on the police department landing page as well, so everyone can find this very easily. Okay. So with that, we're going to move now to Michael Monty, who is the CEO of Champlain Housing Trust. Welcome.
Thank you, and good evening, everyone. So let me describe a little bit of CHT. We do everything from homelessness to home ownership. And we work in Chittenden County, Franklin, Grand Isle County. We also do some stuff around the state. I'll talk more about the homelessness tonight for you. We work with the coordinated entry. We are one of our staff is co-chairs of the Homeless Alliance, which excuse me, does a lot of work on trying to move forward the various homeless initiatives that need to be taken in Burlington and in Chittenden County. Let me describe a little bit. We do 3 different things. Let me describe each one. Over the last, we now have about over 500 people living in our housing who are formerly homeless. So the thing to do really in each and every way is to house people. Nobody gets healthy unless they're housed. You can't be on the street and either get clean or be safe or get healthy unless you have housing. That's the critical thing that we try to do, and we do everything we can to build more permanent housing. 500 right now, 50 over the last 6 months. I expect 100 over the next 6 months. That's not quite enough, but it's really going to actually help quite a bit. In addition, we do a lot of work on in the managing and the development of shelters. We run 2 shelter-like operations, one on behalf of the city of the Ponds, which I have a whole sheet here for information if you ask any questions, and also a motel in Shelburne. We also provide support to about 6 other shelters, a few that CVOEO runs, but also to STEPS, by developing real estate on their behalf and getting them inexpensive places so that they can provide the shelters and support to people. I would say that the other third thing we do, other than doing shelter-like work, is we have a resident services department of about 24 people. About half of them are keeping people housed. Over the last year, they've prevented about 255 people from being evicted. It sounds crazy, they were going to be evicted from our housing. But we went in and made sure that they could stay, okay? When we evict people, it's a failure on our part. We don't take full responsibility always because we never evict unless it's a just cause. But that group basically tries to make sure that nobody gets back on the street and does everything it can to keep people housed. So that's my presentation. Oh, no, it's actually not, sorry.
Yeah, right,
what could you
Michael.
do? That was too fast, I'm sorry. What you do is, you don't need to direct support for us, but support any permanent, affordable housing that you can. Whenever you see it, whenever you hear any legislator going, I'm not sure if we could afford it, say you can't afford not to. The reason why there's so many people on the street right now is because they pulled back on some of that, okay? When there was a motel program, everybody was housed. Some of the stuff that's going on right out on the street was not there. That doesn't exist anymore, as it should be. And what we really need is do shelters in transition and permanent housing as a long-standing solution. So that's what you could do. You have legislators in Chittenden County that need some support and reinforcement and thinking that that's the right thing to do. That's what really you could do. I'm a little nervous, I would say, over the next 6 to 9 months, a year, around a voucher program. Frankly, that's going to be a very difficult situation for us. We can move people out of shelters and from, into permanent housing, but, I mean, in the world of homelessness, there are people who are economically poor, people who need a certain level of services, and people who need deep levels of services, right? And I'm going to throw 3 categories out. I think they're close to being right. All of them always need some economic support at the very beginning. Some of them can get healthy to a place where they can actually afford their own rent, but often enough people need that. And frankly, we're going to go through a crisis, I think, potentially over the next year of having fewer vouchers to house people. Rant, demonstrate, scream at the machine, whatever you need to do to try to see if we could change that, because I think that has a very big impact. I'll stop there.
Oh, well, giving back the minute. You yield back to the mayor.
Yield the
Okay,
minute.
great. Okay, good. Excellent. All right. And then finally, but not least, least but not whatever that phrase is. It's been a long week. Paul Dragon is here, who is the executive director of CVOEO. He's even going to time himself. Look at that. Thank you for being here. Yeah.
Thank you so much, Mayor. Is this on, folks? Can you hear me? Yeah? Okay, yep, thank you. Yeah,
Get as
okay.
close as possible, and if not, I can give you this one.
Oh, my gosh. All right, well, thank you all so much for coming out. CVOEO, Champlain Valley Office of Economic Opportunity. We have 10 different programs, and to the mayor's point earlier, we do a lot of crisis work. Like, we get a lot of food out to people. We've developed a lot of shelters. We also do get crisis fuel out to people in the winter. And then we have longer-term solutions to poverty, like our Head Start program, our weatherization program, micro-business program, and so forth. So we do a lot of different work. We cover about a quarter of Vermont. We have Addison, Franklin, Grand Isle, and Chittenden, and we have some statewide programs as well. So around housing and homelessness, what we've been doing a lot of is developing and working with CHT around shelters. We have brought on a number of shelters over the past 4 or 5 years. We're now doing the Champlain Place, for example, over on Shelburne. We just took on the family shelter in Williston because the state was going to close that. We, of course, have the Community Resource Center that's at 228 North Winooski that sees a lot of people, particularly a lot of people who are unsheltered. We've helped out, and it's been a real partnership with everybody at the Miller Center. So we're doing a lot of work in that space, and our Feeding Champlain Valley program, formerly Feeding Chittenden, does a lot of work around getting food out, not just to the shelters, but delivering it to different places, including unhoused people. I think what we're seeing more and more are people who are homeless, to Michael's point, who also have mental health and co-occurring substance use disorders, and we are seeing a lot of people with chronic medical conditions. A lot of the people that we're seeing at our shelters have a severe and persistent mental health condition, which will go to one of my points, I think, what we need to work on. We are seeing an aging demographic. About 26% of the people who are experiencing homelessness are 55 years and older, and we have a lot of racial disparities. A lot of racial disparities. So homelessness is an equity issue, it's a poverty issue. It's something that we've really had to lean into over the last few years, and you know why. There are so many people out on the street. So I think some of the opportunities for moving forward, I agree completely with Michael. We've got to build and we've got to advocate for more affordable housing, and we've got to get vouchers. We run the statewide home program. It is a rapid rehousing voucher program for families with children who are experiencing homelessness. We have housed 178 families across the state with our partner organizations. That feels really good because if a kid is homeless, we know from research that they're going to have lower educational levels, more social issues, and they're more likely to be homeless as an adult. So it's prevention work. We run prevention programs. We have the Fair Housing Program, Vermont Tenants. We give a preferred renter certificate, so if a landlord does not want to potentially take a chance on somebody, this person can show the preferred renter certificate, and that gives the landlords a lot of confidence because they've gone through our program. I think what we need to do, in lieu of housing, as that comes online with our partners, we have to think a little bit differently about the way we maximize our resources and streamline our services. We have a number of nonprofits here, and we do coordinate. You have to know that. We need to integrate, not just coordinate. We have to leverage our funding. We have to bring our services together. We need medical services on site, mental health services on site. I would love to see an integrated service center for people experiencing homelessness, a one-stop shop where we're all working together to get people stabilized and then to eventually get them housed. I think that would be really, really important. And I think, like, for tangible things that you all can do, we've already lost a lot of federal funding, so funding is an issue for nonprofits, and any donations are always appreciated. volunteering for our Feeding Champlain Valley program or one of our Head Start programs or homeless shelters is really, really powerful as well. And I think advocating, again, back to Michael's point, for systems change. We can't underfund homelessness and then pay all this money into all these other systems because we're not stabilizing people. So thank you all so much for coming out tonight.
You didn't even need a signal because you were timing yourself. Michael wants to have his 30 seconds
I'm
back.
reclaiming 30
which
seconds.
I'm
Thank you.
allowing
Thank you,
just this
Madam Chairman.
once. Don't get any
Gentlemen.
ideas for the next panel, but go ahead.
I just want to say, because we are in Burlington and we're talking about Burlington in particular, but I want to say that a lot of our work is outside of Burlington. I think sometimes people think that everything is in Burlington. I could tell you that most of the places that we have shelters where we're providing deep supportive housing for people who are formerly homeless are in other places, in Colchester, in Shelburne, in Essex, in other communities. And that is also true of the group homes and the other 13 group homes and other things that we do. They're everywhere. I mean, there's certainly clearly an issue here in Burlington around this, and clearly there are some things happening in Burlington that are responding to that. But don't think that Burlington's doing everything, everybody out there is just sitting around. Not true. They are working, those communities are actually incredibly supportive and really want to help and are and have responded.
Thank you, Michael. And I will affirm that because I meet a lot with the city managers city and town managers in the area, because there's not another mayor except for Winooski, Mayor Lott, of course. And there is that, I just want to reiterate that there is a real desire to do what they can within their limited means as much smaller municipalities, of course. We'll get to questions at the end, as I mentioned at the top of the hour. Everyone will be able to answer questions. Yep. So with that, I want to thank the first panel. Thank you very much. And we're going to do a musical chair moment and reset. So thank you very much, everyone. And one of my favorite activities is filibustering when we have to fill time to get people up here. So the next panel is going to be focused on, as I mentioned in the beginning, there's been a lot happening well before this last week, but just in the downtown. And we wanted to make sure it was a chance for folks to join us here tonight to talk about sort of top of mind issues related to our center city. We have folks here tonight from the Burlington Police Department and our Business Workforce Development Office, as well as Department of Public Works. So once they all get seated. We'll do the similar thing, about 5 minutes for each person. They don't have this obviously the same prompts because we wanted to do this more as an emergent topic about things they thought would be relevant and helpful for folks and residents to know about what's going on in the downtown, what we have planned, how we're trying to be responsive and adaptive to what we're facing. So the three folks up here with me tonight are Cara Alaswari, who is our Director of the Business, Workforce, and Development Office, also the Church Street Marketplace. One second, Cara. And then we're going to go, oh, no, I thought you were going to jump into it. And then we'll go to Chapin Spencer. See, I can sense. Chapin Spencer to my left here, who is the Director of the Department of Public Works. And then we'll wrap it up with Lieutenant Michael Henry, who again is assigned to our Center City area. I think I still have that right. Sure. Yeah, okay, great. Obviously from the Burlington Police Department. So thank you to all three of you for being here. I'll give you a nice nudge when we have 1 minute left or so. And we're going to start with Cara.
Hi, good evening. Cara Al-Nasraoui. I do run the Business and Workforce Development Department, which also includes the Church Street Marketplace. We've obviously, since the post-pandemic era, have been experiencing a lot of street-level challenges. I coordinate closely with Lieutenant Henry, who's the lieutenant for our downtown, and we have tried to take different approaches to some of these issues. Obviously, most of these individuals should not be incarcerated, and getting them to services is our most important effort. In addition, though, we do need to recognize some of the impact that some of the street-level challenges can and do have on our economy and our economic vitality, so we're trying to keep a balance between those two issues. I most recently ran something internally called the Hotspots Group, which was an interdepartmental collaboration to try to identify areas of concern in our downtown and find, while we did have BPD at the table, most notably Lieutenant Henry here, some of our solutions, we were trying to orient solutions that were non-police enforcement related. So solutions that could help us identify why these problems were developing, help us try to identify ways where we could solve them, ways that we could understand why people were gathering in certain areas or not, and try and field some of the impacts that some of our unhoused members of our community and those suffering from mental health and substance use issues. Now, we know that those are all different groups of people, and everyone needs, as you know, you heard from the service providers prior to this, who are the experts in this field, of the needs of the different segments of this community, and it's really important to try and understand that. Also trying to get a better understanding of the downtown. I do meet every week with Tammy from the Howard Street Outreach Team to try and understand what they're seeing, as well as folks from the library as well, because the library often has some challenges. We're trying to work on issues identifying where needles are collecting and how we can best address those, how we can try and address some of the graffiti challenges we have that people believe, are impacting the image of our downtown. I do think our downtown is suffering from some long-term reputational damage, and I don't know whether that's all founded or not, but perception becomes reality, and sometimes just throwing events and letting people know that our downtown is a welcoming place for everybody is the best way that we can approach this, rather than taking a heavy hand with law enforcement.
Okay. Thank you, Cara, and she's happy to answer questions as well around just what we've been seeing in our economic trends and whatnot, and I'm happy to talk a lot more about that. Okay, next up, we have Chapin Spencer, our Director of DPW.
Thank you, Mayor. Thank you also.
Oh, that's the one that doesn't work.
Oh,
There you go.
great. Thank you so much, and I just want to thank you all for bearing with me through some generational construction. You all, I know, are working and eating and shopping through some challenging times as we generationally upgrade infrastructure that's over 100 years old. Yes, we are digging through trolley ties on Main Street to replace water mains that are 130, 140 years old. The long-term resiliency of this will be wonderful, and together we are the folks who need to help our businesses and our organizations get through this time. So thank you for eating and shopping locally. Top line messages for the garages and parking is that we have 1,500 spaces in our downtown garages. That's Marketplace Garage and the downtown garage. They are open 7 days a week. We have a diligent crew of 3 people keeping them clean and well maintained. If anybody can find any graffiti in the garages, please let me know, because we are on top of that, and I know that that is no easy task. We are seeing our garage utilization around 50%, which means that there is pretty much always space available in the garages right now, so it is a very accessible and available resource. We're investing around $200,000 a year on security in the garages. We have police and the sheriff in most middays, and then we have private security through the evenings and through the night. We are offering our support to help the administration with the conversation with Food Not Bombs and the downtown businesses. Our interest at Public Works is to find a safe and more hygienic place to offer this service to the public. It is an important service, and a garage is a difficult space without plumbing, positioned immediately next to a drive lane, etc. We are excited to offer some new products for the public that may be of interest to you. We are now offering monthly permits in Marketplace Garage, And in the downtown garage, we're even offering introductory permits, 50% off for new businesses that come to downtown. So for new businesses that are relocating downtown, we're offering monthly permits, as many as they need, for $50 a month, and happy to answer any questions about that. And then for the public, we will be offering punch cards, which are more flexible permits for our garages in the future. We'll be launching this in the fall because, as we know, with post-COVID work, not everybody's coming and working 40 hours a week in the same place. And we only before sold monthly permits, and not everybody is coming down daily. So we're excited to keep evolving our products. We are upgrading lighting in a few places. We've tackled graffiti. We have security in the garages. They're operating well, and happy to get any feedback or insights you may have. Thank you.
Thank you, Chapin. And I'm sure people will probably ask you more about the great street, Main Street, which I'm not going to put you on the spot for, so leave you all questions for where we are with that project. All right, and finally, for this piece, we're going to hear from Lieutenant Michael Henry from the Burlington Police Department. Thank you so much for being here.
Hi, I'm Lieutenant Mike Henry with the Burlington Police Department. This is my first meeting. I'm just sitting in for the chief. We are still increasing our foot patrols in the downtown area in between our call volume, including police officers that are out on foot in City Hall, the Marketplace, Center Street. We're in foot walking, not just driving around. We're also trying to get back to area coverage with patrol, the way we used to do it in the old days, to get more back into community policing. So there would be one officer up in the new North End. There'd be two officers in the old North End, 2 in the Hill section, 2 downtown, and then 1 in the South End. And that's, if we have the officers to do that, that takes 6 to 7 officers. Right now we are still short-staffed, anywhere from 4 to 6 officers per shift in 24 hours, and then it drops for midnights. But we are, with the nice weather, we are trying to ramp up foot patrols and trying to get back out and make it more of a police presence. Our CSOs also help us out, which are non-sworn officers. They can issue the low-level city ordinance tickets, so they're also out on foot with us. I don't really have much more.
I'm sure people have questions, Lieutenant, so it's okay. It's okay. Thank you very much again for being here. We appreciate it. All right. So we are at the point where we're going to, I'm just going to ask the other speakers to come up and we can get some extra chairs, or you can just hover around and we'll pass the mics that work around. We're going to move into the question portion of our evening tonight, and a quick reminder about how we're going to do this. There are cards that I think staff has been handing out that you can jot down a question or two or multiple questions, and then if you can pass them back to staff, they in real time here will start organizing questions around themes, because I'm sure there's at least some similarities in some of the questions. That helps us get through more questions more quickly, so I encourage you to do that. And we will also have space for people to ask questions in person. Now, I want to just remind folks what I said at the beginning. Our goal here is to really make sure we can answer as many questions as possible. So I ask you to be mindful of your airtime. If you want to do more of a public comment style, give us your feedback, give us a longer comment. City council meetings happen almost every other week, and there is one on Monday. I welcome you to that on behalf of the city council. It's a whole 2 minutes, and you can really cover a lot of ground. But we don't have that kind of time tonight, so I just ask people to be mindful of time. And also, just reminding folks that we're going to really I'm going to encourage and ask you personally to keep it respectful and civil. This is an opportunity to build community and understanding, and that is really the goal of these community safety forums. And I know this is a passionate community, and I know there's very difficult and hard things that we're all struggling with and frustrated about, but my ask is that we keep it productive, and if we need to pause, I will pause, because we want to make sure this is a space that we can hear and listen and learn and ask questions and build community. Does that sound good? All right, so while people are writing out questions, does anyone like to start with something in person? And I don't know if we have a mic that moves. Okay. And I can repeat and summarize.
There was a couple of years ago a significant camp, homeless camp, I want to say, in the South End. And this seems like sort of a silly question, but I asked so many people and they don't know. So when I see a lot of, or, more homeless folks downtown, are a lot of them from that camp? Is it really just that it's more visible? And it's not okay that anybody is without a place to live, but I'm just wondering, do you understand, like, what's that? Yeah, like, is this a lot of folks who used to be at Sears Lane, or is there a dramatic increase in the need for services? I know
Great. The question, just very briefly for folks with, who need the mic, and for Town Meeting TV, there be a large encampment in the South End. Are folks that we're seeing unsheltered in the downtown center core living in the various encampments around the city, or is there a notable difference in that population? Oh, you're not Sarah. Sarah, do you want to start, and then we can supplement with on this side?
Yeah. I think I'll start, and then I'll go to Paul, because CVOEO was partnered with the city when that encampment was removed. So Paul can certainly speak to kind of that end of things. Generally, we have seen marked increases in folks who are unsheltered. I know that from the February that we opened the Elmwood Community Shelter, we had roughly 40 to 60 folks who were sleeping outside at that time. Last summer, we had nearly 370 people who were sleeping outside. So are they the same people? Probably not, because folks were, there was a lot of assistance that was provided to move folks into motels and identify other shelter opportunities for them, so we weren't displacing them. It's not best practice to remove encampments unless you have a relocation plan for those folks. But I don't know if you want to say any more about that.
Thanks, Sarah. Yeah, I agree. We did this with street outreach. We did this with the police outreach team. And we received funding from the state to move people into hotels. And we assessed everybody. Some had other exits and other possibilities, but we did move people into hotels. To Sarah's point, I think some may still be outside, but they did have a safe exit years ago. And yeah.
It sounds like what you're saying is there's a dramatic.
Yeah.
There is a dramatic increase, and I will just add, as both a former state legislator and now the mayor, that motel program keeps changing essentially every 6 months, and there's more constrictions in the criteria, and people are pushed out of that program, which pushes people into the larger towns and cities in Vermont. And when I talk to the other 7 mayors in the state, they're seeing the same trends, not at the same scale, but they're smaller communities. Even in the city of Newport, they're starting to see more people living unsheltered outside, and they've never seen that before in Newport.
I just want to say,
Sarah,
the numbers that I just provided are for Chittenden County. Those aren't statewide numbers, so that's our local data.
Okay. We're going to, we'll come to you next. I'm going to go to the cards. As I said, that's our process, okay? So could we have a first question from the cards?
That we collect that we cannot answer, we will post those questions on our website with the answers. So if we can't get to all of these this evening, we will provide answers online that way. This is a question for our mayor. Mayor? What are the performance metrics for CompStat and situation tables? How will we know they are working?
Great, thank you. And the other thing, Erin, who's my chief of staff, just mentioned, data-related questions we'll probably have to get back to people on. So anything we don't answer, that, especially the ones written down, we'll send it out through either on posting on our website and/or through Front Porch Forum. So for CompStat and Situation Table, largely on Situation Table, so we're just about to start with the work with the state and learn from the other 4 communities that have been doing this. Data is a big proportion of what goes into that system for the benefit of the state and also other communities to learn from each other who've already are ahead of us, at least in the formality of the Situation Table. So really part of it is the relentless work. So once an individual is identified and we get the right combination of folks convened around the table, then the work becomes, can we move that person into a less risky situation? Can that person cause less harm? it's literally you continue to do so until the risk comes down for that individual. It's not a one-off and then you see them 3 days later. It's a relentless focusing on that individual. And so a metric, I would say, although we're just about to launch this, so we'll learn a lot more from the training and the setup, is do we start to see the numbers of incidences involving, let's just say, that individual drop, and we will look at the data and we'll continue to reassess. And part of what the model is you keep trying each week. You try new strategies. If you realize you have a partner that was missing at the table because you didn't make much progress in week 1 or 2, you bring a new partner to the table to continue to relentlessly work on this issue. For CompStat has been a long-standing entity within the state and region in terms of looking at data. That, for me, a metric of success is to move beyond just looking at the data trends changing month to month and get back to a bit more of the roots around informing policymakers and collectively bringing folks who need to be at the table to change policies and address gaps. One obvious example is, and we hear this, I still hear this even when I was mayor-elect, gaps in our public transportation system make it really hard for people to access treatment. And that continues to be a problem when we don't make the connection points, when Green Mountain Transit starts to lose money and the state doesn't fund. And I just want to say, shout out to us in Burlington, we support Green Mountain Transit, and he can get the numbers, at a much higher percentage per capita because the city of Burlington residents have deeply valued this service. This is not a slight to other communities, but we are investing a lot in making sure that system runs. But when a route starts to get canceled or hours get cut back, that's a lifeline for someone to be able to get to some of the methadone and other treatment centers that are outside of walking distance, basically, from Burlington. So just one example of that is from CompStat noting that, how do we then activate the right players to change systems as well as procedures and policies? I think that's the answer on that one. So we'll go to you, and then we'll go to back to the cards.
It's off the top of my head. Good evening, audience. I'm the only qualified person in this room able to speak on homelessness. I'm a homeless business owner, and these people are lying to you. I've never done drugs before in my life. I've been working since I was 14. Homeless shelters are stealing money, and they know it. I'm looking at the financial data that the shelters are posting on their own website. I started a business, a nonprofit organization. I just created it this month, turning school buses into houses. Not one homeless shelter, not one church has ever provided funding to me. I am a walking fundraiser. What is this called up here? It's a different group of cards, but the Homeless Alliance, it's BS. I'm the only person that can speak about this. The way this really works is, you guys have been hearing about we need funding, we need funding. The real question is, you've been receiving funding for the last 20 years. What have you done with the government federal funding that every single nonprofit homeless organization has been receiving? Okay? That's the first real question. The second thing I wanted to say is, there's no such thing as permanent housing. I'm not from Burlington, I'm just a visitor. I've lived all across America, okay? The reason why there's no such thing as permanent housing or affordable housing is because you guys that are saying this, you don't set the housing market, okay? And permanent housing, which you guys call permanent housing, is based upon government funding. What happens to the actual homeless person that you say that you placed in this permanent housing? You guys don't collect the data of where that person goes after the funding has ended, and that's a fact.
Okay, so I heard the two questions. One is around funding to our nonprofit folks, about how you use the federal funding, and then also around the permanency of housing and how does that work for folks exiting home, where everyone rearrange themselves. Okay, so Paul, do you want to ask one of our...
Thank you so much for that. We have sheltered hundreds of people, housed hundreds of people. We are monitored by the federal government. We have 58 organizational standards. We're monitored by the state. So we are responsible in every aspect of our business. And our staff has done amazing work and changed lives by housing people and sheltering people.
So why did they cut the federal funding? Why are you guys begging for federal
The federal funding, we got cut, and it's a great question, was our Environmental Protection Agency grant. We haven't had any housing funding, but we think that is coming down the line. I think that's more a question of why the federal government currently is not pledging more money to people who are experiencing homelessness, since it has ballooned all around the country, so that we can continue to help.
We're going to let Paul answer the question, and this is an opportunity for asking questions, and we'll get to more folks, and then, and if you want to engage more afterward, we're happy to do so. Thank you.
Yeah, no, and I think it's great to like always consider the resources, and we may not agree. Where I'm coming from, housing and shelter is fundamental for people, for their health, their mental health. There's just no doubt about it. And to get back on their feet to start businesses. And we do all those things at CVOEO. And we need funding to make that happen. We have over 500,000 people across this country who are homeless today. So I don't think that's a shelter provider issue. I think that's a systemic issue. I think that's a government and a state issue and a resource issue. Just my opinion.
So I'm going to let Michael jump in on the permanent housing piece, and again, happy to have some more back and forth after we're done, which is in just about 15, 20 minutes.
Well, I appreciate the skepticism, but I would say that 500 folks are now, who are housed, and who were formerly homeless are now housed, and we won't displace them. So there is permanent housing, there is permanent affordable housing, and we'll make sure that people continue to be housed and do everything we can to build more so people could be permanently housed. The reason why things are being cut has nothing to do with anybody, well, maybe some people in this room, but mostly because federal rules and priorities are kind of messed up. That's why. That's my opinion. My opinion is that there's
And
been
that's a conversation
change.
for after the forum. Okay. So Erin, do you have another one from the cards?
I do. This is for our friends Cara and Chapin. Chapin, can you share more about the timeline of Great Streets construction? And then for both of you, and the mayor too, if you want to add in, what are we doing for businesses directly impacted by this generational construction project?
Great, thank you for the interest. Great Streets Main Street was envisioned to be a 3-year project with a completion in November of 2026. The project is on schedule. Frankly, it's likely to be completed ahead of schedule. We are expecting, it's a 3-block, 3+ block corridor. And the blocks on the western side, so from Pine Street up to Church Street, we're expecting those blocks to largely be completed this year. There's some more utility work on the block between Church and Winooski. There are 2 water mains on that street. There was the historic ravine sewer, the 150-year-old ravine sewer that was 30 feet down underneath utilities. Took longer than expected, but SD Ireland, our contractor, has gained time on the other work that is more predictable. I expect us to be really in very good shape by the end of this season. This construction season will end around Thanksgiving, and all streets will be open to 2-way traffic throughout the winter, including the holiday season. We are working to open up streets as they are able to be opened, with the fact that we are now, over the next month or 2, having expected to complete the deep utility work. We'll be doing more superficial work that allows us to be more flexible with accommodating traffic and parking. So on to the mitigation of businesses. I will say a couple of things that we have been working on at Public Works, and then I will turn it over to Cara. We've offered subsidized parking. There still is parking. We have subleased the courthouse parking garage on South Winooski. That lot used to be available at $5 an hour. It was privately managed. It's now $1.50 or $2 an hour, city managed. We are supporting a number of other parking promotions. We just had a mud season promotion for Wednesdays and Thursdays, 2 hours free. But we're really working with our business and workforce development folks to do a lot of the promotional effort to the public. I will say we are doing one-on-one outreach with businesses on the ground, so helping them solve their drop-off challenges. We're relocating delivery zones. We are accommodating traffic for late-night performances at some venues, and really trying to go the extra mile to make it work, understanding that the traffic pattern is more difficult than it was before the construction. Cara?
Yeah, sure. It is no secret that these large infrastructure projects are immensely impactful to our downtown businesses. We can see it in the loss of our gross receipts tax, which has been declining, as well as the feedback we're getting when people are sharing their numbers with us. So my department applied for something called the Downtown Vibrancy Grant the past 2 years in a row. Each year we've received $25,000 from the ACCD in the state, and we have deployed that primarily towards marketing. Our grant application was around marketing efforts to mitigate the impacts from this construction. We have done marketing pushes in print, digital, radio, TV, and paid social. In addition, in the past 12 months, the Church Street Marketplace has held or sponsored 106 events. Some are large. Think Jazz Fest, Maple Madness, the tree lighting. Some are smaller. Think we make sure there's DJs out for big weekends such as UVM graduation to make the downtown feel more inviting during times when there is disruption and dust in the air and things of that sort. I will also say that my department, in collaboration with Burlington City Arts, has put on over 100 small events in City Hall Park during this past 12-month period as well. This includes things such as afternoon concerts to bring people downtown during the week. It includes something called Splash Dance for children on Friday afternoons. We also have markets on Saturdays in the winter. We have the winter market. In the summer, we have the summer market. We've collaborated with DPW, as Director Spencer mentioned, on parking promotions. I will say we have 2 channels of social media. One is called Love Burlington, and the other one is our Church Street Marketplace. Through both of those channels, we have a total of 80,000 followers. And we've tracked in the past year, we have had over 4 million views on our content. We have made specific reels and intentional promotions for those businesses that have been harder hit by this construction. We have put banners on the construction fencing. We have also worked with our Department of Permitting and Inspections to relax some of the signage regulations that we have in the city so people can expand their sandwich board signage. And you may have seen, I believe Periwinkles has some of those. They're like lawn signs directing you how to get, they have a lot of them. I know, that's why people are, but
You know they're open.
it's working, and you know that they're open, right? Because you've seen them all. So that wouldn't normally be allowed with our signage regulations, but you know we are allowing that to help drive traffic. We had staff out on Main Street who painted arrows, colorful arrows, and messages that businesses were still open on the street and the sidewalk to help those. We offer marketing and social media trainings for some of the businesses where we're recognizing they're not getting the foot traffic they normally get due to the construction, so we're trying to direct them to utilize social media a little more. Some businesses are not as savvy in that, so we have a marketing team that offers classes to them, either in person or virtually, to try and help them manage some of their outreach. We have also worked with the Department of Public Works to support our restaurants to allow special parking spaces for DoorDash drivers so that those who are becoming more dependent on delivery, they still have easy access for that.
And there's more. We are really working hard to make sure that we try everything we can to support, knowing that there are probably more additional things we can be doing. But I wanted to round that out by letting folks know in this last year, just on the safety aspects of this, we, as I mentioned before earlier, we've invested more in the street outreach team for Howard Center to make sure that that team does not disappear or lose staffing with other changes into their funding sources. We increased police presence during the holiday season with additional funding from the city, and also I personally fundraised with good, strong community partners to make sure we could pay the overtime needed to cover the hours to have more visibility during key weeks of the shopping season. And the hotspots aspect that Cara mentioned, we started last summer. That strategy didn't exist before in a coordinated effort across city departments. And the library was actually the first spot we started with to really think about how do we bring DPW, BWD, the marketplace, the police department, the library, all these entities together to problem solve. And another example was the marketplace garage. Our private security contractor we had at the time was not cutting it, frankly. And so we ended that contract and brought in the sheriff's contract, and have continued to evolve that as we've been trying to make that building safer. And I don't know if you mentioned this in your comments, we have a goal of reopening those towers, those staircases, because that's an important milestone of making sure we continue to make the progress we need for safe places for people to feel safe and be safe. We also I work hard with relationship building with our critical partners and institutions, not only at the Howard Center, but partners like UVM, and interim President Patty Prelock was a great partner. And so we had a really huge successful parade and celebration of the men's soccer team. She talks about it all the time. You think it'd be burned in my brain. That brought like I don't know, thousands of people downtown. It was taking up space in the most vibrant and joyful way of making sure that we have reasons to bring people down and to strategically work that with our partners. And then back to the Howard Center, we are launching some coordination on syringe litter cleanup. So that's the syringe needles to make sure that we're working with them. And the other piece that is this thing that there are a lot of things that keep me up at night, but one of the things we have been able to really start to tackle with earnest is the graffiti part. That is a quality of life piece. So we're working on a lot of angles, as you can hear from the team up here, but continuing to work with counselors and figure out ways to innovate and even start small with graffiti remediation, and then engaging partners. We have some great ones who could put up murals, especially young people, for example, but how do we multiply that, and how do we get more community members engaged? We haven't stuck our landing on that yet. I've lived in Burlington long enough. I remember the graffiti, neighborhood teams. I don't know if members of the public here remember that, but you would adopt your own block and you'd be on top of it. We don't have the AmeriCorps infrastructure behind that anymore within CEDO. That has long gone before COVID. So we have to recreate something we can sustain. It's trickier. And the final thing, just to go back to one of the prompts we had in the first panel, is opportunities for community members to help. One thing I just want to personally ask people to think about is help tell Burlington's story. Tell Burlington's full story, not the one that is tired and distorted at this point and old in the sense of maybe that person has not been downtown in a long time and is operating off some sensational headlines that perhaps are not telling the full story of Burlington, because this is our community. It will not be up to and should not be up to the mayor, to our marketing team within the city, or the city council to do this alone. It's an invitation to help tell full story of Burlington. Why do you love Burlington? How can we help really balance out the story so it's accurate, and we tell and we take care of this beautiful community together. So that's my last plug for all of you. All right, we have time for probably 2 more questions, and I think we're at in-person question next. Yes, hi.
Thanks. Hi, my name's Alex Weinhagen. I live in the New North End, and it's going to take us a while to build our way to more housing, and it seems like we're in a generational place, not just with infrastructure, but with housing and homelessness. We have a lot of underutilized or frankly abandoned buildings in our city. Is the city actively thinking about or trying to work with partners to utilize them? Some of those buildings have been underutilized or abandoned for years, and likely will be for years to come, and in my mind could potentially serve as a bridge for shelter for people until we can create the permanent housing to solve this problem.
Nope, it's a great question. I didn't catch your first name. Alex. That's a great question, Alex. And one which I think everyone is thinking about, because there are a lot of underutilized spaces in Burlington, some more vacant than others if you have been sitting vacant longer. So the city council, and then I signed this ordinance change, did update our vacant ordinance fees. So these are the penalties that happen when you leave a building vacant for a certain number of months and then years. So the steepness of the slope of that fine significantly goes up to incentivize people to bring buildings back online for their full use. So that will just go into effect July 1st. So we have yet to see kind of the impacts of that. Another aspect of that ordinance is that after a third step, if you will, in the process of noticing from the city, it can become a criminal offense to not address your vacant building, the violations of our code, essentially. So we do plan through our permitting inspections office, as well as our city attorney's office, to move on things more quickly and urgently. I've made this a priority for both of those departments to make sure that it means something, that you're not just racking up fines that you don't pay or not pay, that we really have an accountability side of that as well. I can already see, based on the council's good partnership around increasing those fees, from the reports I hear from permitting inspections, some properties are starting to get listed, meaning people who've been sitting on it are finally starting to post things to start moving. So I suspect in the next maybe 3 months, we're going to see some real movement there. Another aspect of this is starting to think innovatively around especially underutilized commercial space, and how do we think about, back to housing, how can this be flipped and what is possible. Now, not all commercial space has really been built in a way that is cheap or reasonable to flip into housing. I mean, there's not a lot of inside windows in a lot of the larger office buildings downtown, but it is something that Cara and I have had conversations with, and permitting inspections, to start to think about and look to other communities. This is something I've consistently asked department heads to do. Look outside of Vermont, look outside of Burlington. We're by far not the only community facing this. So where is there innovation that we can borrow from, learn from, to think about how did they incentivize vacant and underutilized buildings to come back online, maybe in creative different kinds of housing, maybe in other ways. But I want us to be able to make sure that we are not leaving unused space on the table, if you will. Do you have anything you want to add to that, Cara? Yeah.
I will just say that the vacant office space in our downtown is of concern to me. Again, we're finding that the cost of construction, at this point, it's almost more expensive to convert those office spaces to housing, which is unfortunate. And as the mayor said, you end up with apartments with bedrooms with no windows, et cetera. There are movements in other towns to change our zoning, or change one's zoning to allow for things like light manufacturing, let's say, something that doesn't impact other residents in the area. Think maybe someone who's making dolls, or someone who is making spaghetti sauce and jarring it, just things like that. There's different ways that you can approach these sort of vacant spaces, and we have seen some larger municipalities, some of the really larger cities in America, try and tackle it in that manner. And that's something, so we're launching a comprehensive economic development strategy for the city in conjunction with launching our comprehensive plan. So you probably all know Plan BTV. That is now a decade old, and we are looking to revamp that. So to create a roadmap for us moving forward, to try and figure out where we can have more economic growth and how we can change our planning and zoning to allow for that. And that also involves building housing, but it also could unlock opportunities that some of the areas that these vacant buildings are in aren't able to access right now. So we're taking that all into consideration as we launch the comprehensive plans, and those comprehensive plans will involve months of public input.
I also just want to note, and think this is why I have staff, because I can't actually see it out the window. If the leaves were off the trees, you would see the old Y, and I think that's just a good example. There's also good things happening in spaces that don't seem like they're happening quite yet. So you can start to see finally they've started to take graffiti off the outside, but they've been at work on this building for months now internally, and that will turn into housing. I forget the month it's opening. Sometime in the next 6 to 12 months, housing will start to come online, and you'll start to see parts of the building that they won't be using being raised, the old part of the I think it's the pool that's closer to City Market. So as these spaces get reactivated, that also starts to change the vibrancy of blocks and other things. You'll also see, not that it's related to an abandoned space, but it was an abandoned hole for a little while in the center city, just for humor. It's Burlington. We've been all living with a hole in the middle of our downtown. City Place is coming online. The South Tower will be opening in just a matter of a few weeks now at this point. A hotel and housing, 50 units will be in that space. The activation of that block will begin. There's a little behind on the North Tower, more on that soon. But there's pieces that have been already invested in the downtown that will start to shift and change things in our center core. So we are at 7 o'clock, and I promised everyone, because the sun is still sort of up there before it rains on us, we have more community safety forums to come. We're going to take a little break for the summer because it's summer in Vermont, and I don't have to say more because we're all Vermonters. We'll pick this back up probably in the late summer. With a little bit of a different style, I think, because it'll be a year of us having done these community safety forums, but you'll hear more through Front Porch Forum and the mayor email, which I recommend you sign up for, just to hear more about how we continue to do these points of engagement. And on a final note, I really want to appreciate folks for heeding my call and request that we keep this a good dialogue. That goes a far way in these spaces where we can really build community, listen, and get information, share, but hear your ideas as well. So thank you all so much, and have a good evening.